pain is multifactorial. It is not as simple as I did this to my body and I have pain. Pain is protective at the end of the day. Pain being protective makes sense. I just heard it. I need to know what to avoid so my body can heal. If I sprain my ankle, I can't run because that hurts. So that's your body protecting you and allowing you to time to heal properly. But if that ankle is still hurting 4 or 5, 6 months down the road, there's either compensations that have occurred and are leading to different musculoskeletal stressors that are continuing to cause certain types of pain, or there's an impact on your nervous system.
Hello, everyone. Welcome back to the Movement Driven Podcast. I'm Dara here with Dr. Greg. Dr. Greg, how you doing today?
What's going on, guys? I'm doing well. How are you doing, Dara?
I am doing fantastic. Cannot believe it's already the end of February.
Almost my birthday.
Oh,
yeah.
29 again?
Sure.
That's what my mom always says.
I'm just not going to count anymore. Don't ask me what it is. I don't know anymore.
Yeah. No, my mom has turned 29.
So is my mother-in-law.
10, 11 times.
Yeah.
So?
The joke gets old.
Yeah. Well, it to us, not to them.
No.
Which is fine. It's great. It's kind of one of those chronic things that chronic jokes that they let carry on. Kind of segueing into how today we're going to talk about how chronic pain is not a character flaw. Your body is not broken. It's not a character flaw. This is not something that's like, oh my gosh, this is just part of who I am. Right. So let's talk about that a little bit. So what even is chronic pain? And just kind of an example for maybe people who don't know that maybe they are in that, or for people who don't have pain, like to understand what that kind of means.
Yeah, and what to look for and stuff. Yeah.
Sure.
So technically, textbook definition is if you have pain coming from the same source for longer than 3 months, you are now in the chronic pain stage. And what does that really mean? Well, acute pain and chronic pain look mightily different to me, at least, and I treat them completely different in a lot of ways, depending on where you lie on that spectrum. So if we think about like typical tissue injuries, right? Like soft tissue typically takes about 6 to 8 weeks to heal under normal healthy individual. If they have a disc injury in their low back, or they have a tendon strain or a ligament sprain, 6 to 8 weeks, those tissues should heal. Just so you have a cut in your arm, 7 to 10 days later, it's gone. It's a little scar maybe, but you've healed your body. So that 6 to 8 weeks is well within that 3-month range. Even bone fractures, 10 to 12 weeks max, usually 8 to 10 is what we're thinking. So if we're healing between 6 and 12 weeks, depending on what tissue we damage, then why does pain persist? And I think that's where we can get into the weeds of pain is multifactorial. It is not as simple as I did this to my body and I have pain. Pain is protective at the end of the day. So I always tell people, my analogy is, and I might have said it on a previous episode before, if you put your hand on the stove accidentally and the stove is on, you want to have pain because that's protective. And so in the acute stage, pain being protective makes sense. I just heard it. I need to know what to avoid so my body can heal. If I sprain my ankle, I can't run because that hurts. So that's your body protecting you and allowing you to time to heal properly. But if that ankle is still hurting 4 or 5, 6 months down the road, there's either compensations that have occurred and are leading to different musculoskeletal stressors that are continuing to cause certain types of pain, or there's an impact on your nervous system. And that's where, especially those people that have had pain for years, their nervous system has changed to kind of expect pain in a way, and their threshold has dropped where it takes way less to cross that threshold into the pain realm, and now they're feeling pain. So yeah.
Yeah. And I think just to reiterate for our audience who might be listening, that this does not mean that like, oh, well, it's just, you're not actually in pain. It's just your nervous system. I just want to make it very clear that that's a
great point.
Yeah. We're not saying that at all whatsoever. But just to give an example of the types of ways that chronic pain can come to light for people, these are some things that, that they experience.
Yeah. And that's a great point, Tara. And that's something I always try to make really clear when having these conversations individually with patients. Because pain is so multifactorial, it's not as simple as I have this issue in the tissue, as we like to say, and therefore I have pain. There are things like psychosocial factors, right? They've done studies where they've compared the cervical spine on MRI of monster truck drivers compared to just the regular person like you or me who has a little fender bender. And what we see is the imaging on that MRI is usually way worse for the monster truck driver. He's a little older. He's literally crashing things into other things, and while he's riding in them, or sheep, as their profession, they're going to have whiplash injuries and they're going to have wear and tear, but they don't necessarily have as much pain as the little fender bender where I got a little whiplash, but it was enough to affect my ability to take care of my child or my ability to work or my ability to make money. And then all of these other factors and stressors come into play. And pain protection is just, it doesn't get, you can't get rid of it until you address all those little factors. So by no means by no means am I trying to minimize what you're feeling. Sure. I do know you have physical pain, but your physical pain is not, it's not the right, how do I word this? Something that would have bothered you, for instance, if you have low back pain and you deadlift 100 pounds, when you were initially had pain, like right at the time of the injury, that might have caused 2 out of 10 pain. But now, because there's chronicity and there's a decrease in how you can, or let's say there's more sensitization of your nervous system, so it takes less to cross that threshold. Well, now the same 100-pound deadlift feels like it's an 8 out of 10. Well, you didn't hurt your tissues any more than what it was a year ago, but you're still having the same pain, and now you're not doing the deadlift. So what else happens in terms of compensation? Or now we're getting weaker and we can't load the system and be resilient to these forces. So then it takes even less from a physical standpoint to cross that threshold. So there's a nervous system sensitivity happening. And then there's well, if I don't use it, I lose it. And now I'm getting weaker and tighter and all the things that you think of that you need to address with physical therapy. So yeah, multifactorial.
Yeah, absolutely. So let's talk about those compensations that can happen. Just as an example of, like, I've had 2 different knee surgeries on my left leg, and it's not my left hip or my left leg that I really have the issues with.
Yeah.
It is my right side.
Yeah.
And from multiple months and different surgeries of, having to only be able to use my right leg and things like that. So just as an example to kind of like catapult the conversation of, like, what are these compensation patterns that people can tend to run into that keep those pain cycles alive?
So I think the body is really brilliant at compensating. Like, it does a really good job to get the task at hand done. And your body's going to do whatever it can to avoid certain pain to get that task done. So for your example, you have left knee pain, you're going to favor that right side. And whether you know it or not that it's happening, when you're even doing like a bilateral movement, like a squat or a deadlift or a jump or something like that, if there's a imbalance, you're going to use that right side more. Even though you think you're doing a 50-50 squat, that right side's doing more. And then that starts to break down over time. And we have issues on the other side as well. And then your left side is getting weaker because you're not using it. So things can also develop there. So I think the side-to-side compensation is super common, but even more common and even harder to pick out for a layperson is, well, I have my knee pain. Maybe I have it bilaterally. I'm going to avoid knees altogether. And so when I go down into my squat, I'm doing way more hip hinge, but then my hip hinge might not be as good as it should be. And now I'm doing more back rounding and I'm loading my back. And now I'm having low back pain or hip pain. And the kinetic chain, it just doesn't stop until you fix that root cause.
Yeah. So for somebody who the legs, I feel like, as far as like a layman's person can understand the compensation on that, but what happens when there's an injury in your right arm versus your left arm, or even like low back and things like that? Like, what are some of the most common chronic pain areas that you tend to be seen? I mean, I know that the list can be endless, but just what are some of the maybe like ones that are top of the list?
Well, the things that we see, spine pain is always the most. So neck and low back are the most common that we see. And I think, we've talked about posture a lot this month. Yeah. If you have pain in certain postures, you're going to avoid those postures. And then you're going to lose endurance in those postures. So if you have low back pain sitting, then you're going to stand. And then that's going to put more stressors on the lower body. For the neck, for instance, if you have pain in the neck, then loading overhead is not going to be great because I'm using my upper traps to elevate that shoulder blade, and that upper trap connects all the way to the base of your skull even higher. And then that's going to increase compression through your spine when we're doing too much upper trap. So now I'm not even going to do too much overhead. And then how does that affect my shoulder function over time if I'm a very active individual? And I think even like shoulder itself, the shoulder is so complex that if I have a little shoulder pain, where I have, let me back up. If I have neck pain referring to that trap, referring to the rhomboids that connect the shoulder blade, well, if my shoulder blade is not functioning the right way, that's going to have a major impact on my shoulder and along the chain to elbow and even wrist. I see people with plantar fasciitis or people with bunion, my runners. I often think that's starting from the hip. And so, like we always say, it's the issue is never where you think it is. You have to find the root cause. And why is that? It's because they've already compensated for a long time. You're in that chronic pain cycle. The initial injury you had is not necessarily the same pain you're having, even though it feels like it's in the same area. We've talked about a little bit about inflammatory pain versus ischemic pain in the past, right? We have usually that ankle sprain is inflammatory. We have a lot of inflammation, and that everything's acidic and angry, and we need to calm it down. But if we're still have ankle pain after 10, 12 miles of running a year later, that's a different issue. There might still be some inflammation, but there might be some ischemia to other tissues. And we have to identify that and attack it with the right dosage of exercise, the right type of exercise. And that's what we like to do here is really kind of pick it apart and find these pieces of the puzzle that other people are missing.
Yeah. To your point about, the compensation and the things that we need to do. So I think immediately people think, oh well, if I'm compensating, I just gotta stop. I gotta just stop doing what I'm doing.
Right.
So, we talk about this a lot with movement driven. It's in our name. We are movement driven. So movement is extremely important. So can we talk about why movement exposure, not avoidance, is kind of the key to that long-term relief?
Yeah. So with chronic pain, a lot of what I learned in my residency was the fear avoidance behavior model. So it's this whole model of how people that develop chronic pain tend to behave. And so simple, like we go back to the deadlift. If it hurts to bend over and touch my toes, then I'm not going to do that. And if I don't do that, then I lose flexibility of the hamstrings, strength of the glutes, control of the core, and keeping my pelvis and my low back in a stable position while I just move around a stable hip joint, which is how we like to cue a proper deadlift form. And so obviously we have a difference of musculoskeletal weaknesses and imbalances and all these things that happen. But from a brain standpoint too, your body is now trained to every time it bends over, it expects pain. And so your nervous system is trying to, for instance, if your alarm system in your house had a brain and could adapt, when it gets broken into a couple of times, well, now if the mailman or the Amazon knocks too hard, it's going to freak out in effort to protect. And so your body is going to expect pain even when you're past those healing stages, or even when you've gone to physical therapy and done your rehab. So sometimes it is kind of understanding this alone, just the understanding these concepts can go a long way for some people. Realizing, oh, my pain isn't just I have this injury. It's things that have developed, and as I do, now it's the next part of your question, graded exposure, that's how I get back. So I had a patient call me today, and it's a former patient. We had worked on some leg pain and low back pain that he had probably almost a year ago. And at the time he had talked to me about some upper body things that he was having, where he had actually it was open heart surgery. So he had a lot of stiffness and pain and scarring from where they had to open up his sternum and do that open heart procedure. Very traumatic event that can also have an impact on how he feels post-operatively. But he said on the phone, obviously I don't want to go full-fledged into it. And I'm like, that's exactly what you're calling me for.
Right.
That's what we do. And I think sometimes people don't really know what we do. My job is to expose you to the right amounts of exercises in the right ways, in the right order, so that your body can build a resilience. Your nervous system can learn not to be afraid and fear and be apprehensive about certain movements, and realize, oh, wait, I just did a little mini bend forward and I didn't have any pain. And that teaches your nervous system that that's a positive movement experience.
Mm-hmm.
Oh, wait, I'm starting to do things that resemble bending forward. I'm starting to do exercises that strengthen those things. And week by week, we get better. And so a lot of it is, they do this with psychology type things, with just fears and phobias in general. You want to just slowly introduce more and more stimuli to the system so that you desensitize, right? People that have lots of scarring from certain accidents can sometimes be very hypersensitive. And we do things simple like just exposing it to different textures. Little light touch from like a tissue or a cotton ball, progressing to like different fabrics till you get to a rough towel. And you're just basically slowly exposing the body to different stimuli so it builds up a resilience to not be fearful or apprehensive of that, because that's essentially what's happening. So that's what we do for chronic pain, is that we're going to get you back to the deadlift, but we know there's a process there.
Yes.
And we're going to walk you through every step of that process and hold your hand and be your partner. And that's what sometimes people are looking for, that, and they don't know where to find it. Well, it's right here at Movement Driven.
Yeah, absolutely. Yeah. So if you're in the Jacksonville area, or even if you're not, we've said before on multiple episodes, like, shoot us a message and set up a discovery call and talk about, some things that are going on. So
I think we're right for you. We can do virtual visits as well. That's definitely possible.
Yeah, absolutely. Well, I think this was an awesome episode. I can just attest, for myself working with Dr. Greg and Movement Driven in general, the things that, especially for my hips, that I didn't know were my hips, but I thought was more of a knee thing. My body doesn't freak out or get fearful of squats anymore. It feels good. And it didn't take 8 years or all this huge giant treatment plan in order to get to there. So Greg really helps get to the problem and helps you solve the problem. And then from there, it's just a matter of like, let's keep growing and keep training and keep doing our bigger and better things.
And then I think once people realize they can get out of pain, then they start to set new goals for themselves that they didn't even know was possible.
Yep.
Like, hey, I just want to be able to play with my kids.
Yeah.
Well, now it's like, well, you know what? I ran before. I want to start running again. Right? When's the half marathon? Let's train for it.
Yeah.
And so there's things that you don't think are ever going to be possible again. But I promise you, if we get through that first stage, which is the toughest, then, the possibilities are endless.
Yeah. Awesome. Well, thanks, Dr. Greg. I think this was a great episode. As always, if you are in the area or not, you can send us a message or visit us online at movementdriven.com, set up a discovery call, come in for an eval. We can help you keep moving and stay driven. Thanks so much, Dr. Greg. We'll see you on the next one.
See you guys.
Thanks for tuning in to the Movement Driven podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.